The pictures speak for themselves, the worst crisis ever to face the NHS in England. Now there's a government attempt to fix the urgent and emergency care services, but with some caveats, not returning, for instance, to the 95% target of patients being seen in A&E within 4 hours.
We're not setting out that ambition in this statement because the impact of the pandemic has been so severe. We need to set an ambition which is a target that is ambitious but achievable, and that is what we have done.
So it will now be 76% of patients admitted, transferred or discharged within that time by March next year. The plan is to increase capacity with more hospital beds, more ambulances, growing the workforce, speeding up discharge from hospital and new community services to help keep people in their homes. As it happens, a promise of 5,000 new beds includes 4,000 currently temporary beds that will be made permanent. There's a pledge too for over 800 new ambulances, including for mental health. Some of these will be to replace current stock. This is a plan aimed at speeding up access to emergency services, of course, but it's about also keeping people out of hospital in the community. And by doing that, they want better 111 services, things like virtual wards. But it is also a plan with a gaping hole. There is nothing on the much-needed reform of social care and little on the workforce plan, although the Prime Minister promised today that it would be published shortly.
There are some very specific points about supporting people from overseas to work in both the health and social care system, and that's welcome because that's definitely an area where we've seen shortages over the last few years. But it seems pretty light to me on how the additional staff that the plan talks about will be recruited, and perhaps even more importantly, how the staff that we've already got will be supported, because actually this is a plan for next winter and we've got to get to next winter from where we are now.
Many of the ideas in the plan are already being used around the country, but this is an attempt at upscaling, spreading good practice. Warwick Hospital, for instance, has a frailty service working with ambulance crews aimed at keeping older people at home. How can you quantify that the service is working?
I think probably by the number of people that's staying at home, keeping people out of hospital, manage them, in a virtual ward environment. I think probably when you bring in people who actually, when people come in, they're poorly, and they need to come into hospital, then that means you're actually doing the right thing, really, avoiding unnecessary admissions, essentially, keep people in their homes.
The emergency care plan offers little for the short term, and the government will be hoping that flu and COVID numbers continue to fall, so there will be some easing of the pressures on NHS staff and patients to get them through the next few months.
Well, it's time to turn to teachers. Last-minute talks with the Education Secretary today aimed at resolving a pay dispute have failed, so the largest teacher strike in years will now go ahead on Wednesday. Serena Barker-Singh is outside the Department of Education for us tonight. Serena.
Well, these talks between education union leaders and the Secretary of State, Gillian Keegan, was really the last chance to come to an agreement before the planned action on Wednesday. We now know 23,000 schools in England and Wales will be affected, and while not all teachers are set to strike, about 100,000 members of staff will walk out on Wednesday. I think it's fair to say unions weren't particularly optimistic going into this. The meeting had been scheduled for about 25 minutes. It did go over, it went on to about an hour, but afterwards they came out to say that the Education Secretary was squandering an opportunity.
At the moment, it feels like they are trying to maintain a united front that nobody gets a pay rise anywhere. I wouldn't say that I thought that she was out there batting for teachers in government at the moment, and I think she should be, because she's the lead minister for education. She's the lead minister for our children's education.
Now, teachers are asking for about a 12% pay rise, a figure above inflation, and they say that's because they've seen a 20% real terms pay cut since 2010. Now, the government are willing to increase this. They say they're willing to go up to about 5%, but they also say they can't do anything that they think will drive inflation up.
We have to halve inflation because that helps everybody across our country. That's the most important thing. You know, all of this disruption is being caused because of the war in Ukraine and the post-pandemic impacts of inflation. Now, we know that that's there, but we also know it's short-term. We have to focus on halving inflation. Otherwise, a pound in everybody's pocket is going to be worth less for longer.
Now, this is the first of 7 planned strikes, and union leaders today actually said there was a hint that they think the government might come back with a better offer. And if they do, they say that will prevent these other 6 from going ahead.
Well, let's find out. Thanks, Serena. Let's go to Jackie in Leeds. Jackie.
And there's not just many teachers walking out this Wednesday. It's shaping up to be the biggest day of industrial action in more than a decade. Some train and bus drivers, civil servants, university lecturers and security guards are also planning walkouts. The next nurses' strike is planned for Monday. And late this afternoon, it was announced that firefighters had voted overwhelmingly to strike after earlier rejecting a 5% pay offer. Well, joining me now are Corsa Jan, an assistant head at a Leeds primary school, and Maxine Wade, who works as a nurse in Leeds. And Matt Rack, the Fire Brigade's Union General Secretary, is in South West London. I want to come to you first, Corsa Jan, if I may, the teacher. It'll be hard to see how the country functions on Wednesday. Schools closed, trains and buses not moving, huge swathes of the workforce not working. Did you have any qualms at all about adding to that disruption?
Of course we do. Nobody comes into any profession, especially the public sector. You know, none of us have gone in there, let's face it, for the pay. We've gone in there because we're committed. And unfortunately, as you see, that the negotiations have fallen on deaf ears. So there is no other course of action. We've had to do that. And the system is definitely broken, isn't it? I mean, you can see that schools are striking, teachers are striking. We don't want to strike, but we've been pushed into it. We've got 4 out of 10 teachers within 5 years of qualifying, quitting the profession, citing pay and conditions, overworking, underpaid. Since 2010, we haven't had a pay rise. In real terms, that 20% cut. And now recently, you know, we were told that, yes, government will give us 5%. But what they didn't say was that that 5% has to come from school budgets, which is the children's money and schools' money. So that's immoral.
I mean, the Education Secretary today repeating a line that the Prime Minister has said many times, you know, it will just fuel inflation.
Yes,
and that impacts on everybody.
It does, it does. But also you've got to bear in mind that we've got people in the public sector, teachers, nurses, people in firefighters, etc., who are going to food banks because they cannot afford to put the dinner on the table. And we are working 60+ hours a week. Teachers are on their knees at the moment, overworked, and this is not sustainable. More are exiting the profession than coming in. We've got a huge crisis on the horizon because every profession, whether you are a doctor, a nurse, a journalist, needs a good level of education.
Well, let me bring in Maxine Wade, a nurse. The Prime Minister today, talking a lot about the health service, said he would love to see you and your colleagues get paid more, but he doesn't want to have to raise taxes. He says being Prime Minister is not an easy job. He's got a lot of things to balance.
I would say to Rishi Sunak that being a nurse in the NHS or being a paramedic or a doctor currently is not an easy job when you have a high workload of patients, when you're struggling working 12-hour shifts where you don't often get a break. Those are very difficult jobs. I understand that it's a difficult job for him balancing the economy, but he needs to think about what he values and what we should value as a society, and that should be public sector workers like the teachers, like the nursing staff who are struggling to make ends meet and are paying the cost for, to be honest, his poor economic management.
I mean, no movement on pay today, but he does, however, promise thousands of extra hospital beds and new ambulances to help ease the pressure on the NHS. You must welcome that, presumably.
I mean, it's a start, Jackie, but you need paramedics to drive those ambulances and you need nursing staff to care for the patients in those beds. And it's also not looking at one of the bigger problems, which is the lack of funding in health and social care, which is why we have such problems with getting patients in hospital in the first place. I think it's a start, but it would be better if Rishi Sunak and Steve Barclay, the Health Secretary, engaged with unions like Unite and like the Royal College of Nursing to get a decent pay offer on the table and actually begin negotiations, because I'll add, the negotiations haven't even begun yet.
I mean, their constant argument to the nurses is there's a pay review body, they don't want to interfere.
I understand that, but the independent pay review body isn't that independent, and unfortunately they're saying that they can't go against that, but 4 times in the past year the government have vetoed the peer review body, so I don't know why they can't do that for nurses.
Matt Rack, if I may turn to you, the first time in 20 years the Fire Brigade Union has voted in favour of strike. Explain the thinking behind that.
Well, I think, like your other guests have said, people are fed up of falling wages. It's a bit rich to hear from government ministers or the Prime Minister about in public services. Our service has been wrecked over 12 years. We've never seen the scale of job losses, fire stations closed, fire engines axed, job numbers slashed, 12,000 firefighters' jobs going. At the same time, firefighters see their pay under attack year after year, so that, like others, we've got firefighters being sent to food banks. People are simply sick to the back teeth of it, of being treated in this way, being insulted. We were clapped during COVID, along with other key workers, where we saw actually who's really important in society, the ordinary working people who saw our communities through. And then as soon as it's over, we all get told we need to tighten our belts, while some people did very, very well. I don't buy this that there's no money, that some people are getting richer and richer every year, while the rest of us are told to tighten our belts.
Just to be clear, the way it works for firefighters, for your members, is that the dispute is directly with your employers, isn't it? It's not directly with the government.
That's true. The governments are not involved, and frankly, I don't want the government involved directly. And we don't have a pay review body, and as we've learned from health, we don't want a pay review body. We negotiate with our employers. But the truth is that the government does hold the purse strings. About half of funding comes from central government and half from local government. So the government have slashed central funding, so they clearly play a role. They've played a role in undermining our service for the past 12 years, and they are obstructing a deal. But we have offered to meet our employers. We will meet them on the 8th of February. We hope that there is a chance that they wake up to how serious the situation is, they wake up to the level of anger among firefighters, and they avoid a strike by improving their pay offer.
Because just briefly, how does a strike work? We understand the disruption that's caused, for example, in schools. You know, parents maybe not able to send their children into schools, but people will be worried if the fire brigade are on strike. What's the minimum level of standard? You know, what happens if someone's at home and a fire starts?
Of course, it's a very serious step to take, and we don't underestimate that at all, and we want to try and avoid it. In terms of cover, we do have a national agreement in relation to potential return to work in certain circumstances, but actually, in previous disputes, there is a responsibility on employers and chief officers to put arrangements in place, and you can find quotes from ministers in those disputes assuring the public that they have made those plans. We're not involved in those discussions, and that's a question really for the government. But the issue is to avoid the strike, make an improved pay offer and avoid a strike.
Matt Brack, for the moment, I just want to put it to both of you. Public support is critical, isn't it, for this? Yeah. We know that the nurses are often blessed with very, very good support. Do you worry as a teacher? Because when you go out on strike, it means many people can't go to work.
Well, I'll give you an example. Today I held a meeting in school for any parent to come and discuss what their concerns are and to find out about the strike. Every one of the parents, and the room was bulging with parents, were saying, right, what can we do? Is there an online petition? Can we come and support you at the rally? There are teachers, but parents are telling us, we know how hard you work. We know that during lockdown, we couldn't deliver a lesson to one child, let alone, you know, a class full of children. So we have the support. And what we need is the government to be listening and responding. And as Maxine said, that we've got to make sure that we are, you know, negotiating and moving forward.
And I mean, for individuals, you lose pay every time you go out on strike. How much longer can this go on? Because you've been out on strike already and no sense of movement.
Well, we're committed, like other public sector workers are, because we need real change in this country. And ultimately, it's patients that are suffering every single day by the cuts of this government over the past 13 years. And it's not just the strike days that are causing that. These are actions of desperate workers who are desperately trying to get better pay and better working conditions. Yes, obviously, we are losing money every time we go on strike, but we're committed to keep on doing it because we're determined for real change and we're not going to give up.
We'll have to leave it there, but to all three of you, thank you very much for talking to us today.